Good evening, everyone. My name is Jean. This presentation is about tetanus. So, first of all, what is tetanus? And then I'm going to talk about the clinical features, the signs and symptoms, the causative agent, pathogenesis of tetanus, transmission, epidemiology, cultures and diagnosis, treatment and prevention, and last will be the reference. So, first, what is tetanus? Tetanus is a serious bacterial infection that is caused by the bacterium Clostridium tetani. This bacterium produces a toxin that affects the nervous system, leading to stiffness and painful contractions in the muscles, especially in the muscles of the neck and jaw. The infection eventually spreads to the rest of the body, can affect the ability to breathe, and is life-threatening. It is also popularly called lockjaw. It is easily preventable using a vaccine. In the US and other developed countries where the tetanus vaccine is easily available, tetanus is rare, but in underdeveloped nations, it is more common. The incubation period is usually about 8 days, with a usual range of 1 to 21 days. In general, the incubation period is longer the further the injury site is from the central nervous system. Shorter incubation periods are also associated with severe disease and a higher chance of death. Based on clinical findings, three different forms of tetanus have been described. The most common type, more than 80% of reported cases, is generalized tetanus. The disease usually presents with a descending pattern. The first sign is trismus or lockjaw, followed by stiffness of the neck, difficulty in swallowing, and rigidity of abdominal muscles. Progression of tetanus results in repeated painful seizure-like spasms that last for several minutes for generalized spasms. Usually, the neck and back arch, the legs become rigid, the arms are drawn up to the body, and the fists are clenched. Muscle rigidity in the neck and abdomen may cause breathing difficulties. These severe spasms may be triggered by minor events that stimulate the senses: a loud sound, a physician touch, a drift of light. As the disease progresses, other signs and symptoms may include high blood pressure, rapid heart rate, fever, extreme sweating. Spasms may occur frequently and last for several minutes. Spasms continue for 3 to 4 weeks. Complete recovery may take months. Localized tetanus is an uncommon form of disease in which patients have persistent contraction of muscles in the same anatomic area as the injury. These contractions may persist for many weeks before gradually subsiding. Localized tetanus may precede the onset of generalized tetanus, but is generally mild. Only about 1% of cases are fatal. Cephalic tetanus is a rare form of disease, occasionally occurring with otitis media, in which C. tetani is present in the flora of the middle ear or following injuries to the head. There is involvement of the cranial nerves, especially in the facial area. Neonatal tetanus is a form of generalized tetanus that occurs in newborn infants. Neonatal tetanus occurs in infants born without protective passive immunity because the mother is not immune. It usually occurs through infection of the unheld umbilical stump, particularly if the stump is cut with an sterile instrument. In neonatal tetanus, symptoms usually appear from 4 to 14 days after birth, averaging about 7 days. The bacterium that causes tetanus is called Clostridium tetani. The spores are widely distributed in soil and in the intestines and feces of horses, sheep, cattle, dogs, cats, rats, pigs, and chickens. Manual-treated soil may contain large numbers of spores. In agricultural areas, a significant number of human adults may harbor the organism. The spores can also be found on skin surfaces and in contaminated heroin. The bacteria can survive in a dormant state in soil and animal feces. It's essentially shut down until it discovers a place to thrive. When the dormant bacteria enter a wound, a condition good for growth, the cells are awakened. As they are growing and dividing, they release a toxin called tetanus. The toxin empowers the nerves in the body that controls muscles. The C. tetani bacteria is a spore-forming gram-positive anaerobic slender rod. The organism is sensitive to heat and cannot survive in the presence of oxygen. The spores, in contrast, are extremely resistant to heat and the usual antibiotics. They can survive autoclaving at 121 Celsius for 10 to 15 minutes. The spores are also relatively resistant to phenol and other chemical agents. C. tetani produces two exotoxins, tetanolysin and tetanospasmin. Tetanospasmin is a neurotoxin and causes the clinical manifestations of tetanus. Based on weight, tetanospasmin is one of the most potent toxins known. The estimated minimum human lethal dose is 2.5 nanograms per kilograms of body weight, or 175 nanograms for 70 kilograms human. The valence factors of tetanus. Tetanolysin is a heat-labile oxygen-labile homolysin, antigenically related to the oxygen-labile homolysins produced by C. perfringens, S. pathogens, and S. pneumonia. Tetanolysin damages otherwise viable tissues surrounding the infection and optimizes the conditions for bacterial multiplication. Tetanospasm or tetanus toxin is a heat-labile oxygen-stable plasmid-coated neurotoxin responsible for disease manifestations. Tetanus neurotoxin is released upon cell lysis after bacterial growth under anaerobic conditions, for example, in deep puncture wounds. It is antigenic and is specifically neutralized by its antitoxin. Its toxic form is used for vaccine preparation. Clostridium tetani spores enter wound spores germinate, producing tetanus toxins. Toxins are disseminated via blood and lymphatics. Tetanus toxin binds to receptors present on motor nerve terminals, which results in toxin internalization. Following internalization, tetanus toxin gets transported in retrograde way from the peripheral nervous system to the central nervous system by retrograde axonal transport. When tetanus toxin reaches inhibitory neuron terminals, it prevents the release of inhibitory neurotransmitters GABA. In normal conditions, GABA released from inhibitory interneurons induce muscle relaxation by acting on the motor neurons and blocking excitation and release of autoloxin as a motor interpolate. Lack of inhibitory signals to the motor neurons and constant release of acetylcholine to the muscle fibers leads to irreversible constriction of the muscles and spastic paralysis. Spastic paralysis occurs when the muscle stays in constriction, the muscle is too rigid, and the patient cannot move the muscle properly. It causes muscle to twitch uncontrollably or spasm. Tetanus is not contagious from person to person. The infected acquisition is contamination of wounds with tetanus spores. Tissue injuries including trivial wounds, burns, surgeries, injections, deep puncture wounds, and animal bites, etc. The sequence of events happen is spores introduction, germination, exotoxin elaboration, binding to receptors. So we can see the terminology from the whole world statistics. While overall cases have declined globally due to increased vaccination efforts, tetanus remains a public health problem, particularly in developing regions. On this picture, for the African region, Southeast Asia, and the West Pacific region have the most tetanus cases in 2023. Most countries in North America, Europe have less cases. Tetanus remains more prevalent in low and middle income countries, where healthcare access, maternal and neonatal care, and vaccination coverage may be limited. Developed countries tend to have very low numbers of tetanus cases, likely due to high vaccination rates and good wound care practices. Let's see what's in the United States. In the United States, reported mortality due to tetanus has declined more than 99% since the early 1900s and has remained relatively constant since 2000. Sorry. Averaging about 2 deaths per year, several factors have contributed to a decline in tetanus morbidity and mortality, including the widespread use of tetanus toxoid-containing vaccines since the late 1940s. The use of tetanus immune globulin, either for prophylaxis, in wound management, or for treatment of tetanus, has prevented cases and reduced the severity of tetanus cases. In addition, improved wound care, adoption of aspic surgical techniques, and hygiene childbirth and wound care practices contribute to the decline in cases. Further, increased rural to urban migration with consequent decreased exposure to tetanus spores may also have contributed to the decline in tetanus mortality noted during the first half of the 20th century. Of the 267 cases of tetanus, 54 were in people 65 years of age or older, 162 were in people 20 through 64 years of age, and 51 were in people younger than 20 years, including one case of neonatal tetanus. All tetanus-related deaths occurred among patients who is older than 60 years old of age. Tetanus is diagnosis based on clinical features and does not require laboratory confirmation because culture can lead to both positive or false negative results. Doctors diagnose tetanus based on physical exam, medical and vaccination history, and the signs and symptoms of muscle spasms, muscle rigidity, and pain. A laboratory test would likely be used only if your doctor suspects another condition causing the signs and symptoms. Tetanus is a medical emergency requiring care in the hospital. Immediate treatment with medicine called human tetanus immune globulin 500 international unit dose of TIG, administered TIG preparations intramuscularly. Clear all wounds, remove wound, debride neurologic tissue, remove any foreign material, observe wounds for signs of infection, promptly treat infected wounds. Use sedation and muscle relaxant drugs as indicated to control muscle spasms. Patients may require agents to control autonomic nervous system instability. Monitor for airway patency because associated muscle spasms can cause airway loss, depending on disease severity. Endotracheal incubation or tracheostomy and mechanical assisted respiration may be life-saving. Metronidazole is the most appropriate antibiotic. Parenteral penicillin G is an alternative treatment to reduce the number of tetanus bacteria. Tetanus disease doesn't result in tetanus immunity. Vaccination, if indicated, is recommended as soon as the patient's condition has stabilized. Vaccination is the best way to protect against tetanus. There are three types of combination vaccines that include protection against tetanus: DT type, TDT type. Babies and children younger than 7 years old receive DT type, while older children and adults receive Tdap and Td. Babies need 3 shots of DT type to build up high levels of protection against tetanus. CDC recommends these shots at the following ages: 2 months, 4 months, 6 months. Children need 2 booster shots of TD type at the following ages to maintain that protection through early childhood: 15 through 18 months, 4 through 6 years old. Preteens should get 1 shot of Tdap between the ages of 11 and 12 years old to boost their immunity. Teens who didn't get Tdap as a preteen should get one shot the next time they visit their health provider. To maintain protection, CDC recommends all adults get vaccinated against tetanus every 10 years. Once an adult has received a dose of Tdap, they can get TD or Tdap for their booster or doses. Thank you for listening to me.